oncologist that was treating him, and then he was struggling also with coping, because of course at 36 he has dreams to have very lots of achievement that he wants to get and he wants to achieve. And his wife, Lucy, in the picture here, she's also a medical doctor but seeking a different area, okay, as or expertise. And she was very supportive and helped him all the way to during his treatment and whatnot. So they also decided to have a baby when before he undergo the treatment, because once he got into the chemotherapy and whatnot, the he was afraid that he might not be able to have a baby. So they went to through an IVF, okay, and then and finally, okay, his daughter was born on July 4th, 2014. And then so basically um he has the chance to become a new father and to have a family, okay. And then for his treatment, he actually the first stage of the treatment went well, okay. So he was healthy a little bit, okay. The health improved for a while, and he even went back to become a surgeon. However, during the first surgery after the treatment, he couldn't finish the surgery. He went halfway, and somebody has to finish it because he couldn't. His health is still not 100%, or maybe not even, 70% back yet. So one of his sufferings was that he cannot stand for a long time. He cannot even sit for a long time, and he was bedridden most of the time. And after that, his health worsened, and because he stopped to respond to the chemotherapy treatment. And then finally the oncologist decided to stop the treatment because he's not responding anymore. And then he started to spend more time with his family, okay, and friends. And the actually the experience that he mentioned was very poignant. He wanted to give the best for everybody before he go. Okay, so and sadly, in 2015, Dr. Kalanithi passed away without being able to finish the book. Okay, so he started to write because he wants to he wants to have something useful to do, as well as he wants to share his stories, because his stories are quite amazing. Because from the first early years of his medical training, he shared many cases that he has gone through. And he also contemplate with many, because among all the patients that he has treated, some made it and some did not made it. So he shared the feelings of grief and the philosophy of life and death, okay, and whatnot. So when he was after it was diagnosed, he got the like what he was saying, that he has face to face reality with death. Okay, he has to be ready. He has to be make sure that he leaves a good impression or among the people that he has left. Okay, so and one of the most poignant moment in this book was like Dr. Kalanithi um, lies in this on the same hospital room where his wife gave birth to their daughter. Okay, KD. So these are the picture. Okay, their picture. So basically, he actually described the journey Okay, from the first few years when he was being a doctor, and the experiences, even the description was very vivid. If I'm not a medical doctor, but I can imagine the what he has gone through, and all the feelings he has inside of his inside of him during the treatment, and when they told him that there's no more chance to live. At first his doctor did not give any time frame of how long he's going to live, because they were positive, because he's young, still young, 36 years old, and then he has a, you know, a big, I mean, he has a fair chance of survival. However, because of sometimes it's just because stop fate and everything. So when his health deteriorate, so he actually they actually gave him some time frame, how much time he still got until the end. Okay, so basically this is a very emotional book, and also it gives you some insight about the how, because we don't know when we are going to die, but for him, he has to face it, full on, and then start to plan how he wants to live with the time that he has got left. Okay, so it's a very vivid book. So because he's also a good writer, and then basically towards the end, when he passed away, so his wife has to, because of she wanted to complete the book, so she used all his notes and whatever correspondence, email and whatnot, to research on how to finish the book. Okay, so and finally she finished the book. So the book was published posthumously 10 months later in 2016, and then so basically it becomes a worldwide bestseller. So what I want to highlight from this book is something that we can learn from, is that make sure that you really take care of yourself, your health, and if you find anything wrong with you, anything out of ordinary, try to seek treatment as soon as possible. Okay, don't procrastinate, don't wait, don't delay. And life is short. Okay, and then we don't know um how long we do have to live anyway. So appreciate the people around you, appreciate what you have, appreciate everything, and be grateful for whatever that you have, and take every opportunity you have to do good deeds to other people. And then basically because once um, um, when we in our life, the goal is not to I mean, if all the risky that we have is good, but we want to return in the best version of ourselves, the husnul khotimah. Okay, so inshallah, by if you read okay, go through the book, it's a very inspiring way how to live your life to benefit others, as well as to be um, to bring good to other people. Okay, so I think, okay, so actually there's a video that I want to share. So I think we still have time for the video. So let me just it's about his last journey. Okay, so let me just go to the video. Okay, let me share the video. Just a minute. Okay.
Clocks are now kind of irrelevant to me. Time, we're used to have kind of a linear progression feel to it, now feels more like a space. Oh, la, 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 la. If you asked me when I was 17, what I'd be doing with my life, I would have said, oh, I'd definitely be a writer. For me, literature was always a powerful reflecting tool for thinking about life. But found after I completed my undergraduate studies and for the first time really thought about what I was passionate about, medicine was in fact the perfect place. In the life of a neurosurgery resident, time is linked to progress. And as the numbers on the clock increase, so too should your progress towards some goal. I first began noticing symptoms in my 6th year of residency, and so I ended up having a full body CT scan, and there were metastatic lesions kind of all over the place. Obviously, Lucy and I were both very suspicious that I had some form of cancer, but actually having the confirmation was still devastating. And so we were in the hospital room and we just kind of laid there and cried a little bit. And then called my parents, my brothers. After finishing chemotherapy and coming out of the hospital and entering this recuperative phase and not working, time is very different, where I'm not thinking about how each 15 minutes is going to contribute to some greater productivity. Verb conjugation is particularly confusing for me, for the verb to be. I finished neurosurgical training, so I am a neurosurgeon. I'm not practicing currently. If I get healthier, I plan on getting back into clinical medicine. So in that sense, I will be a neurosurgeon, or I won't, depending on how things go. And so I don't really know what the correct tense to use is. I am, I was, I will be, I had been. There's definitely a funny double sense I have at, say, clinic visits. As a physician, you're constantly concerned about how far behind you're getting and how many patients you have to see. And the faster you can get through your appointments, the better. And so, whenever I see a doctor, there's always an awareness in my head that the little clock in the back of their heads is ticking. Certainly, medical training is very future oriented because it's all about delayed gratification. And so you're always thinking about 5 years down the line, what are you going to be doing? 5 years down the line, I don't know what I'll be doing. I may be dead, I may not be. And so it's not all that useful to spend a lot of time thinking about the future beyond lunch. Since Katie's birth, my time with her has had a very peculiar and free nature. In all probability, I won't live long enough for her to remember me, or certainly not have any clear memory of me. And so, the time is what it is, which is fun because she's a really good baby. There is a disjunction in time between how I perceive time and how I perceive my daughter Katie's time, because she's in this rapid phase of development, whereas my sense of time is very static. And so there is kind of a inherent tension between those things, which, sometimes when I'm reading a baby book or someone remarks kids grow up so quickly, there's kind of a pang because I'm not going to see, most likely, that growing up happen. And the faster Katie grows up, the faster I'm not there. At the same time, every day is an exciting, rewarding, meaningful time to spend with her. Hope is a very funny thing. Certainly as a doctor, I felt it was very important, and the way in which patients come to understand and make meaning of their diseases is one of the pillars of what matters about being a doctor. And the way hope functions for me now as a patient, it's a careful balance. If you don't think about the bad case, that ending is going to be very rough on you and your family. But if you don't think about the good case, you're going to miss an opportunity to really make the most out of your life and time. I met a traveler from an ancient land who said, "Two vast and trunkless legs of stone stand in the desert. Near them on the sand, half sunk, a shattered visage lies, whose frown and wrinkled lip and sneer of cold command tell that its sculptor well those passions red which yet survive, stamped on these lifeless things, the hand that mocked them,
and the heart that fed. And on the pedestal these words appear. My name is Ozymandias, King of Kings. Look on my works, ye mighty, and despair. Nothing beside remains. Round the decay of that colossal wreck, boundless and bare, the lone level sands stretch far away."
Okay, so that's the story of Apo Kalanithi. Yes, I think if you have question, so I'm happy to listen to and to answer, inshallah.
All right, thank you, Dr. Normi, for the interesting review. Basically, what I can say that this book review actually is a good reflection to us that it talks about the passion, the individual's passion, the struggle that Dr. Kalanithi went through to be healthy again and prepare himself before his death. Actually, it reminds me of one verse in Surah Al-Ankabut, verse 57. Allow me to share with you the meaning of the verse, which is, every soul will taste death, then to us you all will be written. So whoever you are, what position you are, whether you are top people or you are the ordinary person, we will soon return to our Almighty Creator, Allah Subhanahu wa Taala. So now it's time for the Q&A session. If you have any questions, you may ask Dr. Normi, or if you want to ask in the chat box also can, then I will read your questions, inshallah.
Okay, any question? just to further explain or describe the book, many comments of the book are very, they are actually because of his background is in literature. So basically many good comments was given for this book. Okay, so for example, moving, humble, impossible to ignore. Paul Kalanithi's memoir, Split My Head Open with Its Beauty, truly madly deeply. And basically it's a moving story about struggles to be healthy. So whenever that we are being tested with whatever health issues or money issues or whatever problems that we have, inshallah, when we ask from Allah, okay, everything will be easier to bear. Okay, no matter how big the problem is, inshallah, Allah will help us to bear the um, um, problem and whatever challenges that we face in life, inshallah. So that's also a good things to learn, okay, from his experience. So even the book was finally completed when even when his already passed away. So and was completed and published and to be shared with everybody. Okay.
All right, any question?
Any question, or if you want to have comment, you want to share something, is also welcome.
Dr. Normi, I have a question.
Yes.
All right. Dr. Kalanithi, Paul Kalanithi basically died in 2015, right?
Yes.
And then he actually did not manage to complete his book, and it was continued by his wife. And then basically his wife is not in the literature major, yeah. Basically she's actually in the medical domain. So how's the writing styles? Is it something different from Dr. Paul Kalanithi and compared to his wife?
Yes, actually she got help from other writers as well to basically complete it in a way that how Paul already written it before. She has studied the way he styles and everything. But by the way, the unfinished part is just a small percentage, so it's not like most of it has been written by Paul before he passed away. So his wife just tried to compile other the things that she can get from emails and correspondence and his notes and whatnot. So basically, it's just a small amount of extension to what Paul has already written. And the another thing that was highlighted in this book was whatever tragedy, because when he was a doctor, he has to break good news and bad news. Okay, so the way that they are trained to be compassionate to the patients, even though it's a bad news, but the way that they convey the bad news has to become to just to help them to absorb the impact of the news. Okay, so basically the next of kin, the way that they communicate with the next of kin is also they have to use diplomatic word and compassionate words and things like that. So I think if I mean all of us have our own share of losses. So basically, when I read this book, I can feel okay the way that he's trying to explain how in medical word in medical terms and medical his medical experiences, how to deal with um, um, things like death and when there's no more hope, what can you do to ease your sufferings and things like that. Okay.
All right, thank you, Dr. Normi.
Thank you.
Is there any comments or do you have any questions to ask? If there's no, I think thank you, Dr. Normi. Inshallah, we are looking forward to having you again in the future. Thank you very much also to the organizer, the ICT Resource Center, and co-organizer, the ICT Promotion and Marketing Team for organizing this seminar. Thank you everyone for your participation in this webinar, ICT RC Sense. We hope to see you again next time, inshallah. Let's end this session with Tasbih Kafarah and Surah Al-As. All right, thank you everyone. Alhamdulillah.
Thank you.
Thank
Hope you
you.
enjoyed
Thank
this.
you, Dr. Normi.
Maybe you want to try to read the book, inshallah. Thank you.
Dr. Mira,
Yes.
boleh leave ke?
Boleh.
Off record, Mira.
Okay.
Alright, bye-bye. Thank you.
Thank you.
Thank you.